Hey guys, Dr. Rich here from Optimal Spine and Joint Center, and today I'm going to talk to you about knees. We're going to see two knees on the screen here. One knee is going to be a damaged knee and one knee is going to be a normal knee. So let's go over normal so you know what damaged look like. Okay, so when we're looking at a normal knee, what we're looking for is alignment of the knee. So we want to see that the bone top edge will match the bone bottom edge down here on both sides. We also want to look for the space between the knee. Okay, so that space, that shadow here is also supposed to be nice and thick. And then one other thing that we look for is the position of the bone that's called the patella, or the kneecap here, that sits in the center. Okay, now an x-ray is useful, but it also can be not as useful as an MRI when we're looking at younger people's knees, because sometimes we can have a knee that looks like this on an x-ray, but on an MRI has significant problems. And so we have to make the determination as to when to use one diagnostic image over another. In older people, x-rays are quite useful, and this is an older gentleman who happens to have a really bad knee. And if we look at his knee on his left side, what we're going to see is that that space in the middle is basically completely gone, and it's bone touching bone here. And on the outside, there's a little bit of space, but again, the middle is bone touching bone. The alignment of those bones is off. You'll notice that this edge is not lining up to the one below it. So let me show you that with a marker here. Oh, if I can, these two edges do not line up. And then again, these two edges do not line up. And so we're seeing the bone shearing or sliding off to one side. And then again, we mentioned that patella in the center, and you'll see his patella is all the way to one side here. So in this case, you know, this gentleman probably needs to have a knee replacement surgery. If he doesn't do a knee replacement surgery, he opts not to. There is some treatment that may be given to him that can help. And in another video, I'll go over treatment things that we do for these cases, some of which are bracing, some of which are physical therapy, laser shockwave. And also in other cases, we will also go over some new therapies like stem cells or plasma-rich platelets. And for another point of purpose, what can be happening inside this knee? So I'm going to bring up this little thing here, and we're going to be looking at the spaces. So we're going to look at that knee, and here's the knees down here. And we're going to look at the meniscus, which is that tissue in between. Okay, is that spacer that we saw in the x-ray. And then what can happen, of course, is people get meniscal injuries, and those are where they tear or rip. And so there's different types of injuries that can happen here. We have an injury in which this is called a buckle injury. We can also have a linear tear. Okay, so that means that there could be a linear tear like this. There could be a horizontal tear. So there's many different types of tears that can happen in meniscus. Okay, we can also look at what we call the ACL. And so the ACL is the ligament on the inside. Okay, the ACL or the PCL. A lot of soccer players, football players tend to get this injury. It's the ligament on the inside that keeps the knee from shoving forward or sliding forward, and it sits on the inside. And so they call it the cross ligament. So you have the ACL and the PCL, and what can happen is that ligament can get a partial tear, or all the way through tear, or a complete rupture. In this case, let's show you a complete rupture. It rips all the way through, and now that person's knee is unstable. Again, usually they'll do a surgery for this. There are other options though, and again, I'll cover that in another video. And then finally, that third area we are looking at on that gentleman's knee is the lateral side of the knee, and this is called the MCL and the LCL. And so we have these two ligaments on the outside that hold the bone together. And in this case, sometimes we can, when that bone shears, it can rip. And so again, his bone was shearing. So we go back to those x-rays, and what we'll see is, sorry guys, what we'll see is that bone sliding out to the side here. And so we know it's shearing, it's affecting that ligament out to the side. We know that meniscus also has problems. Okay, and then he has ripped the ACL and PCL inside as well. So guys, this is the knees, all right? And again, in another video, I'll cover how we correct those knees. Now, if you guys have any questions, feel free to give us a call at 944-88580. Again, that's 944-88580. Or you can make an appointment online or visit our website at www.optimalsj.com. But again, give us a call. If you like what you're hearing, please like our page, comment below. Again, tell me what kind of videos you want to see. And keep in touch. Thanks guys, talk to you later.